evening, everyone. Thanks for joining us. You are with the LD9 ticket, Brian White, Ryan Young, myself, and we have a special guest this evening of Geoff Ginter. Some of you may remember him due to his interaction at a town hall with Representative MacArthur. However, that is not why we have him here this evening. We have him here this evening to speak about some of his work in the field of healthcare and also the impact of the Graham-Cassidy ACA repeal and replace bill, which right now is on the floor and is being debated in Washington, D.C. So if you have any questions, please feel free to send them in. We have a couple volunteers behind the scenes who will be working and asking those questions of us. So I guess the first thing that we want to talk about is really what the Graham-Cassidy ACA repeal and replace bill does, and then what its impact is on the New Jersey residents. And I'm actually maybe going to turn this over to Geoff, who has a little bit more knowledge about that and has been very well versed in about what the actual bill does, and then we'll get a little bit more into specifics.
The only thing to really keep in mind about this bill, what it does, is it takes the money that you currently get from the ACA, from the Obamacare. Doesn't take away those taxes, which is why people like Rand Paul are voting no, because it's not cruel enough. But it's taking those and simply sending it to the states in block grants. New Jersey will get X amount of dollars, and New York will get X amount of dollars. And the states will decide how to go about spending it. The biggest impact is that it repeals a lot of the Obamacare protections. The pre-existing conditions are no longer going to be minimized. You will be able to be charged more for a pre-existing condition if the state that you live in decides that it wants to do that. The essential health benefits, maternity care, emergency room care, prescription drugs, you name it, any number of things that a healthcare plan needs to have in order to be effective, in order to be true insurance that will be useful when you need it, as opposed to paying for nothing and be junk insurance. These essential health benefits will no longer be mandated. It will be up to the states. You will be at the mercy of your state legislature to decide how they want to go about spending this money. And it's going to get draconian because this money dries up in 2026. So everything from Medicaid, regular Medicaid, and expanded Medicaid, everything from Obamacare is now a block grant that will eventually go away in 2026. Goodbye. Mm-hmm. So they're phasing out Medicaid, they're phasing out everything, and leaving it up to the states. So watch your backs, because your pre-existing conditions, which if you're over the age of 30, chances are you have one already on the books, documented. No matter what it happens to be. The previous version, the previous iteration of the repeal and replace that MacArthur was responsible for had on its list of pre-existing conditions sexual assault and acne. So chances are you're in that boat. And it's going to be up to the states to determine what they consider to be a pre-existing condition. So there's no more protections. There's no more guarantees. It's whatever the state now decides. And that's disastrous, completely disastrous.
And one of the most recent things I was looking at was that in New Jersey alone, that this could threaten the health care and access to health care of 900,000 residents in New Jersey alone. Easily.
And that's just now. In 2026, God only knows what that number is going to be.
Mm-hmm. Mm-hmm. And so can you talk to us a little bit about what that might look like in everyday life? You work in the healthcare field. What does that mean for the patient who is currently receiving care under the ACA for, say, MS, a pre-existing condition, and is receiving their infusions that are, right now being funded through the ACA?
Sure.
What kind of impact is that going to have on that type of patient?
On that type of patient, the costs are inevitably going to go up. because right now, with the ACA, there are no lifetime caps. It doesn't matter how much it costs for your life, how much something costs. So if you have MS, which is a lifelong condition, you will be covered for your life. Your plan may have some deductibles, it may have a premium, but you won't be able to suddenly be 50 years old, have spent everything that your insurance company has decided they will pay for you for your life, and now you're on the hook for the rest of your life. So this is disastrous for a patient like that. And we already have situations with just your regular, average, everyday patient who hates going to the doctor, not because they don't like doctors, but because they're terrified of death. They're terrified of dying. They would rather not go to the doctor, hope that it just goes away, and it never does. So by the time things get really bad, then they finally go to a doctor, assuming they have health insurance. We're going to compound this problem now, because even people who would normally go to a doctor on a regular basis are in danger of not being able to afford their health insurance plan. It's going to be the choice between, I need a roof over my head now, I need food in my belly now, and I need clothes to keep the wind off my back. After I've satisfied all these things with the economic situation that we have nationally, I don't have anything left over to pay for insurance, most especially junk insurance. Why would I pay you $100, which is relatively reasonable, if I have a $5,000 deductible and lifetime caps? I'm not going to be able to use this insurance. I'm giving you $100 out of the goodness of my own heart, apparently, my rapidly diseased heart. So we need to be very clear about what's going to happen. The ACA is not perfect. As far as I'm concerned, it is still part of a for-profit healthcare system, and that needs to change. Healthcare should not be for-profit. But going from the ACA to the Grand Cassidy bill is a disaster of biblical proportions.
And do you think that this is moving from that this argument is now coming to a pinnacle of, is healthcare a human right, or is it a luxury that is provided for those who can afford it?
I think that is the debate that is happening right now, and it's been happening for a while. The difference is that the argument in favor of healthcare being a human right has gained a lot of traction. If you look back through history, God did not come down from the mountain in 1787 when we wrote the Constitution to say, these shall be thy rights that thou shalt have until eternity. Humans did that. And the humans that did that were slave owners. They committed genocide against Native Americans. Women were not allowed to vote. There was an entire swath of the population that were not afforded the rights that they enumerated. So for 250 years, we have been fixing this problem. We have been fixing that mistake. What this means is rights are ours to fight for or to give up. So if you think that healthcare is not a right, I'm here to tell you that your time is done, that you are no longer going to be able to run the table with that argument. I'm not going to try to change your mind. I'm here to tell you that I've got hundreds of millions of friends, and you're done. Healthcare is a human right. The argument is over. It's now become semantics. So it is my hope that you just get on board.
One of the other things that I know that the repeal replace bill that's on the floor right now talks about is the Medicaid expansion.
Yeah.
And New Jersey has been one of the forerunners in saying, yes, we're going to take a lot of the money that is funneling down from Washington D.C. and putting it towards the Medicaid expansion. And so I was looking at some of the numbers today, and it was in the first 6 years that New Jersey could lose $10 million of what that is now funding, and that's going to go to states who don't provide that type of support, and that by 2036 that number then grows to $112 billion. I know some of the effects that could have potentially on women's health, just because it's a personal passion of mine. But talk about some of the effects that could have on the citizens of New Jersey if this Medicaid expansion is no longer offered in New Jersey.
Well, one of the things that Medicaid expansion really helped do, just take kids, for example. My children get their Medicaid, get their health care through Medicaid. So when MacArthur wanted to take $800 billion out of Medicaid, he was threatening my children. And Graham Cassidy does nothing less than threaten my children. They may as well, be coming right to them and telling them, I don't care about you. You don't matter. So to them I say, I'm sorry, but your time is done too. Senator Cassidy, Senator Graham, thank you very much for your service. Goodbye now. We got this. So children are going to be at threat because so many children in the state of New Jersey get their health care through Medicaid. Also, and I'm sure anyone who is in a lower to middle class family understands that most government services don't like you because you're right on that line. You make too much money to be able to get government service, but not enough money to be able to pay for the things that you need government service for. Medicaid expansion helped close that gap. It did not eliminate it, but it helped close it. So if you're a hard-working individual, you work 40 hours a week, you work 60 hours a week, and you get your health care through Medicaid, you are at risk. You are at serious risk because chances are when the hammer comes down from the states about who they're going to cover and who they're not, they're probably going to go for the kids first. So you are saving the kids first. So you're really at threat. But the kids are also at threat because they won't be able to do it forever. When 2026 comes, no one is safe. No one.
And that also includes the population that I know that Ryan is proud to call himself a part of, is the veterans.
Yes.
Yep. The veterans themselves have seen the change going on within the DVA, and our healthcare itself too is we've had the reports of the places out in like Phoenix and stuff where these secret lists were created, and that's not the right answer. How are these heroes coming back and our healthcare system is failing them? The Veteran Health Organization is, yes, it's not perfect by a stretch of any means, but the fact that the rate at which they're trying to fix it is still almost appalling at times. It's we finally got the ability to go to any doctor, and that was a step in the right direction. But even that still at times came with restrictions. I know my personal self. I never got that card that they talk about now because apparently I lived within the radius of a health clinic. So then I didn't meet that program all of a sudden. But it's beyond, and like Jill mentioned, not only with the veterans too, but I'd like to also put one of my other hats on too, is the millennial generation too, and that's one of these groups that this is going to underemployed, and this is starting to affect us now more than anything because we're getting to that 26-year mark of the ACA. We're now we're off of our parents' insurance, and now we're out there fending for our own, and it's they're going to now change these things. So how many are they even going to lower that age again now back down to
It'll be up to the states. It'll be up to the states. Whatever the state thinks they can afford, based upon whatever revenue they can pull in versus whatever the federal government will give them. And the federal government, as I said, is going away.
Well, Jeff, let me ask you on that. Are there any federal controls under Graham Cassidy that can limit what the states can do or provide some protections for citizens like
That's a good
the
question.
ACA did?
And I haven't seen one yet. But then again, there are 4 versions of Graham Cassidy out there right now. So it's hard to know what they would actually wind up passing, assuming they're even bringing up for a vote, now that they got 3 no votes. The federal government has opportunities and responsibilities that they simply don't want to live up to. The federal government is not fiscally restrained. The federal dollar is tied to nothing. This whole deficit issue is bogus. The federal government creates money by fiat. It is an at-will monetary system. It can never go broke, ever. It could never be unable to pay its bills. The chairman of the Fed has said this already. 2 chairmen of the Feds have said this. There is nothing stopping the federal government from being able to pay its bills, creating money and paying it to someone. The problem remains with inflation, and inflation is a reflection not of how much money is in circulation, it is a reflection of how much resources we have to pay for those things. The cost of bread goes up when there's not as much bread for people that want to buy it. So if everyone has money and there's still plenty of bread, that's not a problem. But if there's plenty of money and there's not enough bread, that's a problem. So our question at the federal level is, how do we create and maintain a system that keeps us as a productive society? Mm-hmm. You can make Social Security fiscally strong. You simply pay into it at the federal level, not through taxation, but the federal government just simply demands as fiat, just the same way we pay for war. No one ever asks, where are we going to get the money for war? They simply get it. They do an appropriations bill and it's done. Do the same thing for healthcare. Do the same thing for Social Security. Do the same thing for college tuition for everyone. As long as we have the resources for it, and we're making sure that we have in place a system that creates wealth and resources to be able to use that wealth to purchase, then we're good.
Just on that subject, you mentioned before that New Jersey is poised to take a large financial hit if Graham-Cassidy is passed, because New Jersey accepted the Medicaid expansion from the ACA. What about the states that, for political reasons and only political reasons, decline the Medicaid expansion? What's going to happen to them?
They're going to get a nice reward, because they're basically saying, you didn't get any money before, well, now you're getting all this money. But since we're making an even distribution, see, the thing that they're talking about with Graham-Cassidy is making an even playing field. They're saying that some states don't get ACA money. They don't talk about why they don't get ACA money, because their GOP governors decided not to do it. So it wasn't because Obamacare decided to penalize certain states. Certain states decided to penalize Obama. So now that the Cassidy-Graham bill wants to make it an even playing field, everyone gets the same amount, but that means that if you didn't get it before, you now get some, and if you got it before, you have to get a little bit less, because, and this is part of the problem I'm talking about, on the federal level, no one has to do with less. There's no finite amount of money that the federal government has. If it's available for purchase in US dollars, the federal government, being the monopoly issuer of the US dollar, can always pay it out. So it's a bogus limitation to say that there's only so much to give out. At the state level, we do not issue our own currency. We use the U.S. currency. We need taxation at the local level to be able to pay for programs, and what we can't pay for through with taxation, we need the federal government to fill in the blanks. The federal government is playing the fool, saying, we're just like you, dude. We only have so much money. We can't possibly give you what we don't have in taxation. So GOP says we have to cut programs. Democrats say we have to raise revenue. They're both of them lying to you. We don't have to lower taxes. We don't have to raise them either. We don't have to cut programs. We can raise how much we spend on it at the federal level. So what they're doing right now is causing huge pressures on the states. They say states' rights, states' rights, states' rights. You know best how to spend this money. But they're also on top of that saying, you know best how to spend this money, and we're only going to give you so much. We're not going to give you enough to actually do anything with that money, but we will give you something out of the kindness of our hearts. And oh, by the way, in a couple of years, we're not going to give you anything.
And if the states decide we're not going to cover pre-existing conditions or something like that, too bad if you live in that state.
Absolutely.
Right?
So let's take a look at a situation where I could get a great job in another state. I can't do that, if that state does not offer the same conditions. Not only does not having a single payer, create a system where it really matters where I work. I don't have to. I can't be an entrepreneur. I can't pursue my dreams, because if I do that, I have no health care, and my family needs it. So I don't get to be the best version of myself. I don't get to pursue my dreams because it is just fiscally not possible. I need capital to be able to buy health insurance. And if I'm starting off from scratch, if I'm trying to build a better mousetrap, if I'm trying to be the entrepreneur that we're told we need to be, I can't. So even the ACA does not get us there. But on top of the ACA not being able to do it, Graham Cassidy destroys it completely. So your state can be Shangri-La, and you could be getting a lot of people in there, but that's horrible for the state you just took it from. So if New Jersey does not implement a good health care and a good distribution of that, we could have a huge sucking sound as everyone leaves New Jersey.
And let's hope those no votes stay no votes.
Absolutely.
On the Republican side.
Yeah.
So we've discussed healthcare now for a little while. We have a couple of questions here. So what is the impact of the Graham Cassidy repeal and replace bill on women's health as well as mental health?
Well, there's a couple of components that it affects the women's health that is going to be impacted. So any woman who receives coverage under the current ACA bill, with the new bill that's proposed, due to the more state level control that will now then be available, and also due to the reduction in the Medicaid, women are going to see a big impact on contraception, other preventative health services, screenings, things of that nature, screenings during pregnancies, especially. And then also one of the major things that I was reading about was that new mothers who are covered under Medicaid could lose their coverage after 60 days of delivery due to the strict eligibility requirements that are now required. So now you have a woman who is 60 days out, has a newborn that's 60 days old. That newborn's not going to be covered, and neither is that mom for continuing services that she may need. And those are health services, and also mental health services, specifically with postpartum depression and follow-up care that's needed for stability in raising a healthy family.
Not to mention the mental health issues, and I'm not kidding here, that will be raised by that new mother having to figure out how she's going to pay for everything.
Yes.
Because it's just a nightmare. No matter what type of health care you need, they want you to be the one to go out and find out how much it's going to cost. And there's not a hospital in the country that wants to be able to just say, this is how much it costs to have a baby. This is how much it costs to have an MRI. This is how much it costs to have a bypass surgery. They want to be able to itemize every little thing. And that means that nothing is included. Nothing is included. So the cost of something varies drastically depending upon where you go. And they won't tell you how much it is. They'll, at best, if you get a nice person on the phone, they'll give you a ballpark guess, but they could be way off. They're certainly not going to be under. And it's going to be different place to place. Different places. In a market-based economy, if we use healthcare in that fashion, a more affluent part of the world is going to be more expensive, and a more less than affluent is going to be less, which is crazy. It's absolutely crazy. It costs what it costs. This ability to charge more based upon where you are is already, as far as I'm concerned, immoral on so many levels from so many different types of services. But on healthcare, it's indefensible. It's absolutely indefensible.
And that's just for the initial care. That's not even talking about the follow-up care that is required for so many conditions, especially when you're talking more severe health conditions.
And that's something I want to talk about, if I could take a second here. A lot of people will say that you already have access to healthcare even if you don't have insurance. It's called the emergency room. And people that say that either knowingly are lying to you, or they really don't understand what an emergency room is for. An emergency room is mandated to stabilize you. So if you have chest pain, if you have difficulty breathing, you go to an emergency room, they will stabilize you. They will not cure you. They will not fix you. They will get you to a point where you can leave the ER. And they may give you a prescription for a few weeks at best of medication, but then they will tell you explicitly, follow up with your doctor, which is the things you don't want to hear when you don't have health insurance.
Mm-hmm.
You can't follow up with your doctor. So you're going to wind up back in that ER.
And that's also too for even, when you think about raising your children, and, I think about the time that my son broke his wrist.
Yeah.
And it was like, okay, we brought him to the ER and they stabilized it, and it was, fine for 48 hours, but then we were required to follow up with the orthopedic and also his pediatrician and follow
therapy.
through with all of that, yes,
Yeah.
to ensure that, there wasn't permanent damage done with that. So I, having lived that experience, yes, I can see that. And also, my dad has suffered through heart conditions throughout the years, and it's always the same.
Yeah.
If he's had to go in for an emergency, it's okay, let's stabilize him, and then now let's bring in his cardiologist, or he's going to see his specialist and things of that nature. So I totally agree with you on that.
Even if you have insurance, and you go to an ER and they admit you, assuming they don't keep you for observation, which they'll charge you for, if they admit you, you could be asleep, have another doctor come in who's not on your plan, just come in, take a look, check you out for a bit, and then you get another bill, and you're on the hook for that. Even though you have technically great insurance as long as it's in network, but that doctor wasn't in network, even though he works in your hospital.
So I guess the question is, and to kind of bring all this back to home, what can residents and voters, even non-voters, just citizens of the state, do in order to make sure that their voices are heard? I think immediately is calling the representatives.
Absolutely.
And letting them know how they feel about this. There's plenty of scripts online. If you're not comfortable about what to say or what not, what you should say or who to call, there's definitely plenty of organizations online who can help you do that. But I also think that the second most important thing is getting out in November to vote.
Absolutely. I think one of the things that has been lost in this country is civic engagement. If you are a citizen of this country, there is an implied responsibility for you to be a part of our collective destiny. We are trying to shape it now, and for 40 years, I'm 47 right now, I have noticed engagement go down. And there's really no excuse for it. There was no excuse for my lack of engagement up until last November. There was no excuse for it. I feel the weight of that. I am ashamed of that. And I'm never going back to that lifestyle. And I encourage you to not do what I have done. You've got to stay informed. Watch the news and watch them all, because they don't necessarily all want to tell you the same things, and they don't want to tell you what's really true. So really find out as best you can what's going on. Find out what they don't want you to know, and then call your representatives, and then yes, please register and vote.
All right, well, thank you everyone for joining us tonight. We look forward to seeing you out on the campaign trail. And if you have any questions, please feel free to email us or contact us through our social media pages. NJDEMS, 4, LD9. Thanks again. Have a great evening.
Thank you. Good night.